Hello, I'm Dr. Herman and welcome back for another video here. And we've got a lot to share with you. And I'm going to share this video on my cancer website called Hope for Your Cancer. I'm going to share this with people on other websites that I have because I take care of people with autoimmune diseases like multiple sclerosis and lupus and people with strokes. And this is really important to understand because this kind of bacterial infection called Mycoplasma or Brucella can actually lead to conditions that mimic Lou Gehrig's disease, that mimic multiple sclerosis, that actually can cause a presentation in the brain that looks like a cancerous tumor when it really never is a cancerous tumor, and it's all caused by this bacteria. So listen to this. Mycoplasma mimicking a brain tumor. To the best of our knowledge, we describe here the second case of Neuro Brucellosis, which is a presentation of the bacteria in the nervous system, in the brain or spinal cord. They're describing a second case of Neuro Brucellosis mimicking a cerebral tumor caused by this Brucella bacteria infection that I've talked about in a few other videos on my website here. And I will show you, listen, I'm going to have to read some information while I'm telling you what's on this, on the research here, because I don't have it all memorized, but I do know what's going on here and what I'm talking about. But I'll also give you some research sites that you could look things up on and you could read this for yourself, okay? The mass lesion was clinically and radiologically indistinguishable from a brain tumor. So on the X-ray, the lesion in the brain, they couldn't distinguish it from a brain tumor. It looked exactly like a brain tumor. The diagnosis was established by isolating this Brucella bacterial infection in a blood culture and a positive Wright's agglutination test on a CSF, on a cerebral spinal fluid test. This person, a 20-year-old woman, presented with left arm and left leg numbness and weakness for a month. 1 week before admission, the symptoms had become particularly severe and even had a mild headache. The patient had a history of previous brucellosis, previous Brucella Mycoplasma infection. The diagnosis of brucellosis was first made 4 months previously. At that time, she was given some antibiotics and she remained free of symptoms until 1 month previously. So that just says 4 months previously she had symptoms, they found this infection, they gave her antibiotics, the symptoms went away, but then it came back about 3 months later. Upon examination, the patient was febrile, and the neurological examination showed left-sided paralysis again. I'm going to skip through some of this because there's too much to read here. They found in stains in blood tests, they found the stains, there was no bacteria, mycobacteria was not there, regular bacteria were not there, fungus was not there, Lyme's disease was all negative. They found, they found inflammation of the brain. They did a lumbar puncture to see if anything else. The examination of the cerebral spinal fluid showed no pleocytosis, which is a protein, and sugar levels they couldn't find. No bacteria, no mycobacteria, no fungus. All results, even for a certain kind of mycobacteria, was done and it couldn't be found. All results were coming up negative, even for a cytomegalovirus. Herpes virus was negative, Epstein-Barr virus was negative, rubella was negative, toxoplasmosis was all negative. No viruses were found, no bacteria they could find, no mycobacteria, no fungus. They looked for everything. And what they finally found was a positive for Brucella melitensis in a blood culture. Let's go back a moment. She was treated for Brucella before with antibiotics. Symptoms went away. 3 months later, symptoms came back worse, and they found that the patient still had this Brucella infection in her body. The central nervous system involvement in brucellosis or neurobrucellosis, they say, is rare. Well, not everybody's being tested by their doctor, so they're saying it's rare, maybe from who they've tested. Maybe they only tested a couple of people. How many of you with MS or cancer have been tested for Brucella? How many of you with lupus or fibromyalgia or neuropathy have been tested for Brucella? Or transverse myelitis? How many of you have been tested for Brucella? How many are with headaches or stroke or cardiac heart disease have been tested for brucella? How many of you with neuropathy have been tested for brucella? Because of its nonspecific manifestation and broad spectrum of clinical syndromes, neurobrucellosis may occasionally be overlooked. Brucella exhibits a great affinity for the meninges, meningitis. Therefore, the most frequent clinical syndromes associated with neurobrucellosis are meningitis or meningoencephalitis. Remarkably here, we also observed neurobrucellosis as another condition, mimicking viral encephalitis. In conclusion, despite its rareness, because people are not really being tested for it, it is crucial that neurobrucellosis be considered in the context of solitary intracranial lesions, tumors. They need to look at this. So there are patients with cancer in the brain, what this says, mimicking a brain tumor, meningitis, and they're not even looking for this brucella infection. And even if they found it, they'd give it antibiotics. And just like you heard about the story of the 20-year-old, symptoms went away, came back with a vengeance. There are natural substances that we can use to really help get rid of this infection. It can be done, but we've got to look out for it. Okay? So a brain tumor may be because of an infection. And there are studies that show cancer really is chronic infection, chronic toxicity that needs to be overcome so your body can be healthy again. And I can help you do that. I'd love for you to integrate your care program with what I have to offer you. And we can help give you a better shot at helping you save your life and reverse your cancer. Look forward to helping you. Give us a call, 954-370-3100. And thank you for letting me come into your home and share this information with you. Thank you very much.